Good afternoon. Thank you for joining us for an update on the Burdett Birth Center. I'm Dr. Stephen Hanks. I'm the President and CEO of Trinity Health New York, which includes St. Peter's Health Partners here in the Capital District and St. Joseph's Health in Syracuse. And as you all know, St. Peter's Health Partners is proud to include Samaritan Hospital and St. Mary's Hospital here in Troy. We've been here in this community since 1848, when St. Mary's got its start in its original location. It was at the time known as the Troy Hospital, and it became St. Mary's actually not until after World War II when the name was changed. And then St. Peter's Health Partners was created through a merger back in 2011, where we brought all these health systems together under one roof. But the one thing that's really never changed is our commitment to providing the broadest array of services to our communities where we provide service. And it's not an easy task. And it was with that our board, the board of Samaritan Hospital, a year ago, made the very difficult decision to recommend the consolidation of our deliveries in Albany at the St. Peter's Hospital. And you've heard us speak about these realities over the past year. They include a declining birth rate, the increasing percentage of birthing women who are in a high-risk category now, as birthing women tend to be older on average than was historically the case. And the high-risk deliveries have to be managed in higher capacity centers like St. Peter's Hospital. And these realities are continuing. Some of you may have seen just a week ago, the CDC announced the lowest birth rate on record in the United States. And in fact, it's a global issue. The only parts of the world that are still having sustainable population-related birth rates are Africa and the Middle East. All of Europe, most of Asia, most of North and South America, the birth rates are below the level needed to sustain the population. And that's the reason, and I've got to be honest, I myself was surprised to hear this. There have been 500 maternity units that have closed in the United States in just the last 20 years. Now, there's only 4,500 hospitals in the United States. So now you're talking over 10% of hospitals have had a closure of a maternity unit. Now, since we've announced our closure, the passion of this community for what we do here at Burdett has rung through very loud and very clear. We have been listening. We've been reaching out. We've been building relationships. And we've also engaged our legislators, many of whom you see with us today. And on the basis of very, very hard and difficult work done in particular led by Assemblyman John McDonald, working with his colleagues in the legislature, they have found a way to provide some grant funding for us that will allow us to continue delivery services and perpetuate Burdett Birth Center for at least the next 5 years. And on the basis of this, our board, the Board of Samaritan Hospital on Friday, unanimously voted to rescind its decision to close the Burdett Birth Center. And the board further ordered our leadership to withdraw the closure plan that's been submitted to the Department of Health. So I just want to thank everyone. I want to thank our community for your support. I want to thank the team that runs our hospitals here in Albany, led by Kim Baker, immediately to my right, who runs Samaritan Hospital and the Burdett Birth Center. And I especially want to thank Assemblyman McDonald and all of our assembled local leaders who've been stalwart in their support, not just of this community, but of our health system. At this point, I'm going to ask Assemblyman McDonald to say a few words.
Thank you, Dr. Hanks. And what a beautiful day. We are here to celebrate the rebirth of the Burdett Birth Center. And as you might guess, there's a lot of thank yous to Dr. Hanks and his team and to the board. Thank you for rescinding the request to the Department of Health. I also want to thank, surrounded behind me, the many elected officials from the state, the county, the local level, Congressman Tonko as well. I know he has a representative here as well. We always have had a great open working relationship, and their support throughout this process has been critical, and I want to thank all those elected officials. To the Save Burdett Coalition, what a crew. I have to tell you, for a group that I did not know that well, I know bits and pieces. It kind of reminded me a little bit in my generation, the Bad News Bears, first time out there. You have done a remarkable job on raising the voice of the community and engaging the community. This is great work on your end. I would also need to thank my leader, Pat's leader, Scott's leader on certain days, Carl Hasty, in the Assembly, and also our health chair, Amy Paulin, who have been very helpful throughout this process. Now, last year I wrote in a published piece in the Times-Union that it was not hyperbole to say that keeping Burdett open was a matter of life or death. We're all aware, and Dr. Hanks brought up these points, that in this country we have a maternal mortality crisis, and Burdett is the only birthing hospital in Rensselaer County. Without Burdett, the health outcomes could have been drastically worse. Admittedly, though, for all of us, every single one of us, no matter where you were on this issue, it's been an emotional ride for all of us. But now, it is a time to come together as a community for a new beginning. The community's voice was heard, and there is a greater appreciation for the work that Burdett accomplishes relating to maternal health. We now have an opportunity to expand Burdett's reach in our communities, and as a model of care, we can welcome our newest members into the world while focusing on improving health outcomes. Now, I'll be very clear. I've learned more about midwifery in the last 10 months than I ever thought I'd ever learn. Roger Ramsini at Hudson Valley loves to do these little things, so I'll do this. Did you know that between 2019 and 22, over 50 50% of the births were midwife-delivered catches. I state this for this reason. Burdett is well known for its focus on midwife services. And as many know, particularly in the minority communities, it's a trusted service. It should also be noted that the New York State Department of Health has solicited comments this past fall in regards to reducing barriers to midwife-led birth centers, and we anxiously await the next steps from the Department of Health. The rising popularity of midwifery birth centers across the country indicates that the Burdett model is one that can and should be replicated throughout the state. The commitment from the Assembly passed in the budget this past week for a $5 million grant over 5 years for a maternal health grant program at Burdett has many goals and has many requirements. This grant will not only keep the doors open, but also allow Burdett to increase staff training in poverty, racial equity, implicit bias, and trauma-informed care, while also partnering with community-based organizations and doula services to support increased pre- and postnatal care utilization. The grant also seeks to identify opportunities for enhancing and expanding midwife medical doctor cross-training in a hospital birth center environment and collect the necessary data. The goal is greater utilization here at Burdett and also for greater staff retention. Now, it is wonderful news. We have to remember, though, that the work is only beginning to putting Burdett on the path to a sustainable future. The numbers Dr. Hanks talked about in the beginning are real. We're not immune from that. And at the same token, and as my colleagues know, healthcare as a whole has been dealing with staffing shortages, I would say before COVID-19, definitely exacerbated during COVID-19, and we have to continue to find ways to address that issue. I and my colleagues are committed to continue to advocate on these and other issues, and I will continue to work with St. Peter's Health Partners, the advocates, and community members as we move forward. In the public piece I mentioned earlier, I urge mothers to continue to choose Burdett for their births. Today, collectively as a community, we re-up that request to the members of our community to keep showing up, saying how much Burdett matters, and please continue to have your birth at Burdett. One more comment, and this is off script, but to Dr. Hanks and his team. You know, I've been in politics for 25 years. You deal with a lot of things in your lifetime. But the one thing I've always heard and understood very well when there's conflict is that you need to talk. And throughout this process, on the good days and not so good days, there's always been conversation. And conversation can lead to success. And success is what we are seeing today. Congratulations.
Thank you, Assemblyman. We're not out of the woods. Staffing challenges remain, financial challenges remain, but now we have time. We have time to move forward, to find a sustainable path. I hope we're never back here having a similar discussion about closing a service, especially one that's so needed in our community. But the stark reality is that healthcare systems are under enormous strain. I think you all appreciate that. I and my team are doing our best to try to maintain high quality, safe services to as broad array of our community as we possibly can. But it's support from people like all of you that will help us to sustain and help us to thrive. So please have babies and have them at Burdett Birth Center. And thank you for coming out.